I'm the owner of Medicare Made Easy, Craig S. Weiss Insurance. I've been a Medicare specialist for well over 17 years, and I'm talking to you today about the most important time of the year for those of you who are on Medicare, which is called annual election period, also known as Medicare Open Enrollment. These are the things you can do during Medicare Open Enrollment that I'd like to talk to you about, and then invite you to contact me for help with any subject matter, any questions, or any plan issues that you have during open enrollment. And all changes that you make will always take place in January 1st of next year. So what is Medicare Open Enrollment? It's the time of the year between October 15th and December the 7th where people that are on Medicare Advantage plans or Medicare prescription drug plans can make changes to their Medicare options. You may have received in the mail in September your annual notice of change document, typically sent in a large white envelope from your insurance company. And this year, you're probably noticing some wild changes that are happening in the marketplace. Rates are going up by over 100%, 200% in some cases. Benefits are declining on Advantage plans. Deductibles are increasing and copays are increasing on drug plans. And the reason why is because Congress a couple of years ago passed the Inflation Reduction Act so that people could get vaccinations and different types of medications at an affordable cost, more so than ever before. But at the same time, the insurance companies are passing along the upcharges to you because of the reduction in costs they're able to capture from the Medicare beneficiary. So those of you who haven't heard this yet, the maximum amount that you would be responsible for paying for prescription drugs in a particular year is capped at $2,000. After that, there are no copays. So the thing called the donut hole that we've been accustomed to for many, many years now has been eliminated. And basically now there is initial coverage on your drug portion of your plan, and you'll pay the actual copay for that particular drug up until the maximum true out-of-pocket cost is reached of $2,000, and then you will pay no copay at all. It becomes catastrophic coverage. So that's the main reason for a lot of the changes that are happening in premiums and benefits and plan changes. You're also going to notice that a lot of plans have been eliminated this year due to the same facts that I just talked about. In different areas, some new plans may be issued, some old plans are being eliminated, some people will be walked into another plan that's been replaced and put in place by the carrier, etc. So as soon as October 15th comes around, what you'll want to do is analyze your medications for your drug plans and compare it against all the new drug plan offerings that there are in the marketplace. You can also, for a particular reason that you might have an issue with a plan, you might have a doctor that's left one of your Advantage plans, your HMO or your PPO, and you need to find a replacement plan so you can continue seeing the same provider, or many other reasons, possibly just looking for new or additional benefits if there are any this coming year. And you can make that change to a plan that's being offered for 2026 during open enrollment. You have up until December the 7th to make your change, and you're allowed to make as many changes as you want. So if you change your mind and move to one plan and then decide on another plan, since it's still open enrollment, you can still do that. And the same thing is true with your drug plan. Now, another thing I want to talk about are Medicare supplements. You might know something called Plan F or Plan G. What those plans are, different than an Advantage plan, is they're not an HMO or a PPO at all, but they're a secondary plan that allows you to take your Medicare red, white, and blue benefit card anywhere in the United States and see any provider who accepts the Medicare benefit, which is almost everybody. And you would present your Medicare Plan F or Plan G card to that provider so that you're not being charged a copay or the annual deduction or any of the other gaps that Medicare holds for you. So the secondary plan or Medicare supplement's a great option for those people who can afford it, because they have the portability to go anywhere they want to go where Medicare is accepted in the United States and seek services. Whereas on the Advantage plans, you have to usually go in-network or see an out-of-network provider on a PPO at a higher cost. The Medicare supplements have made incredible changes in terms of premium because people are living so much longer and using more services. And if you're to the point now, if you have Plan F and you can no longer afford to pay your premium, you might look at contacting me and changing to Plan G. Plan G is a newer plan that was introduced in the marketplace just a few years ago that replaced Plan F, with the only difference being that you would be responsible for paying an annual deductible, whereas Plan F covers the annual deductible. But because Plan G is so much of a newer plan and there's less claims experience, you'd probably find that your rates could reasonably be cut by about $1,000 a year when you look at it. So it's worth taking a look at. And depending on where you live in the United States, there could be medical underwriting, or there could be a special election period which allows you to change your supplement even if you do have underlying health issues already on your medical records. So when you talk to me, I will explain where you live, how to make a change, if you can make a change now, or if you'd have to wait for your birthday month if you can't answer health questions, for example. But the important thing to realize is that open enrollment period that I'm talking about between October 7th and October 15th and December 7th is only for people that are adding an Advantage plan or changing an Advantage plan or changing a drug plan. If you have a Medicare supplement, Plan F or Plan G, you can potentially make that change any time of the year. It doesn't have to be done during Medicare open enrollment. And maybe there'll be a special election that can help you accomplish that with any underlying health conditions. It's something that we would discuss personally on the phone, and I could refer you to one of my advisors. Now, Medicare plans are issued all over the United States, and if you have any questions on any aspect of Medicare, feel free to reach out and call me. My number is in this video, and I'll be happy to refer you to one of my affiliates anywhere in the United States, or if you have friends and family that would like good, strong information and many, many plan options to look at, have them give me a call, and again, I'll refer them to my affiliates because I have licensed affiliates all over the United States that can help you. Simply ask questions, learn as much as you can about Medicare. Try not to get tempted to take phone calls from unsolicited salespeople that occur daily, which is against the law. And take a deep breath, because Medicare open enrollment is going to be a huge event this year. Once you take a look at the changes that are happening to your drug plan or your Advantage plan, it is worth taking a look at other options to see if there's something that could be more affordable. So thanks for your attention. I hope that this little snippet of information about Medicare open enrollment helps you, and that I've given you a resource to contact just for questions and answers. No pressure, no salesmanship, none of that. And I really advise you to stick with one advisor, if that's me or anybody else, to get your information from, because there are salespeople throughout this industry that are commissioned to sell you a plan. Whether your plan is working great or not, they're going to put a spin on it and try to get you to make a change to make a commission. That's what I found that this business is. And if it ain't broke, you don't need to fix it. That's my words of advice for you. However, I understand everybody's looking at options to save money. I understand this year is going to be one of the worst years for rate increases, and I'm happy to help you take a look at other options. So hopefully this is insightful for you, and it gives you some good information to start your journey. But as always, feel free to contact me. I can help you with any questions and answers or point you in the right direction, whether you work with me or not. It's a service that I've really dedicated myself to. I have a very large book of business. I've been doing this for many years, and I really enjoy helping each and every one of you. With that, I bid you a great afternoon. Thank you very much for listening.